On October 17, 2018, Canada became the second country in the world after Uruguay to fully legalize recreational marijuana use nationwide. The regulation and control of the cannabis market were seen as a means to address the concerns associated with the illegal market. Legalization aimed to undermine criminal organizations, ensure product safety, and generate tax revenue to benefit society. The legalization of marijuana in Canada was a momentous step toward embracing personal freedoms and acknowledging the shifting attitudes towards cannabis use. It aimed to strike a balance between individual rights and societal well-being. Let's talk about cannabis and cannabinoids. When we talk about cannabis, it generally refers to the whole plant, including the flowers, leaves, stems, and seeds. Cannabis can be consumed in various forms such as smoking, vaporizing, or ingesting edibles. On the other hand, cannabinoids are a group of chemical compounds that are found within the cannabis plant. Over 100 different cannabinoids have been identified in cannabis, each with its own unique properties and effects. The two most well-known cannabinoids are THC and CBD. THC is responsible for the psychoactive effects of cannabis, commonly associated with the feeling of being high. CBD, on the other hand, is non-intoxicating and is known for its potential therapeutic benefits. So how do cannabinoids work? Introducing the endocannabinoid system. The endocannabinoid system, or ECS for short, is a complex signaling system that exists in all vertebrates, including humans. It consists of receptors, endocannabinoids, and enzymes, all working together to regulate various physiological processes. According to Dr. Peter Greenspoon from Harvard Medical School, the cannabinoid receptors in the brain, the CB1 receptors, outnumber many of the other receptor types on the brain. They act like traffic cops to control the levels and activity of most of the other neurotransmitters. This is how they regulate things, by immediate feedback, turning up or down the activity of whichever system needs to be adjusted, whether that is hunger, temperature, or alertness. The discovery of endocannabinoid system has opened up new possibilities for medical research and therapeutics. Scientists are now exploring how the manipulation of the ECS through cannabinoids may offer potential therapeutic benefits. By modulating the ECS, cannabinoids have the potential to provide relief from multiple distressing symptoms experienced by terminally ill patients. One of the most significant benefits is their analgesic properties. Studies suggest that cannabinoids can effectively alleviate pain, including neuropathic and cancer-related pain. THC and CBD have demonstrated antiemetic properties, helping to reduce distressing symptoms commonly associated with nausea and vomiting, regardless if they are caused by their illness or the treatments they undergo. THC specifically has also shown promise in improving sleep quality, helping patients achieve more restful and rejuvenating sleep. Studies suggest that CBD may have anxiolytic and antidepressant effects, providing relief from mental health challenges such as anxiety and depression. THC can stimulate appetite and potentially help patients maintain their nutritional status, especially for patients experiencing loss of appetite and cachexia, a condition characterized by severe weight loss and muscle wasting. While cannabinoids show promise in symptom management for terminally ill patients, it is crucial to acknowledge and understand the potential risks associated with their use. One primary concern is the psychoactive effects that may impair cognitive function and pose challenges, especially for patients requiring mental clarity or having specific safety considerations. Cardiovascular effects are another concern. Cannabinoid use has been associated with an increased heart rate and transient changes in blood pressure. For patients with pre-existing cardiovascular conditions, careful monitoring is required to prevent any potential complications. Additionally, respiratory health is a crucial consideration, particularly when cannabis is smoked. Smoking cannabis can irritate the respiratory system that may lead to respiratory symptoms such as coughing, bronchitis, or worsen pre-existing respiratory conditions. Alternative methods of cannabinoid administration such as oral or topical routes may be more suitable for patients with compromised respiratory function. Another important consideration is the potential for drug interactions. Like other medications, cannabinoids can interact with various drugs, including those commonly prescribed for pain management, sedation, or other symptoms. It is vital for healthcare professionals to carefully assess potential interactions and adjust treatment plans accordingly. Lastly, individual responses to cannabinoids can vary significantly. What works for one patient may not be equally effective or well tolerated by another. Close monitoring and regular evaluation by healthcare professionals are essential to ensure the safety and optimize the benefits of cannabinoid therapy. There is, however, another consideration that is not normally talked about. Canada has always been known for its diverse and inclusive society, attracting people from all corners of the globe. Over the years, it has become a hub for students seeking quality education, particularly in healthcare. What's interesting is that the landscape of Canadian classrooms has evolved, and today, a significant portion of healthcare students are international students. So, what makes this phenomenon unique when it comes to handling or administering cannabinoids to their patients? We asked a question to some current palliative care international students from Niagara College what their thoughts or feelings are knowing that we can administer cannabinoids here in Canada. Charles from Ghana said that he was shocked because back in his country, anyone found in possession of a narcotic can be imprisoned for 5 to 10 years. Heba from Egypt said that she has mixed feelings and is curious about its legality in Canada. She is intrigued by the opportunities it has but may also have reservations due to cultural and personal beliefs. She emphasized that Canada has taken a progressive approach to this. Sanjita from India said that she initially thought of the patient's safety. She also said that she was curious and is now eager to understand this culture and has since concluded to accept this change in her belief. She genuinely appreciates Canada allowing its citizens to make their own health choices. We also interviewed a previous international student from Niagara College who is now a nurse here in Canada regarding her experience. We first asked her the same question.
My thoughts or feelings after learning that I'm able to administer cannabinoids to my patients were I was scared at first because I am not familiar with and doing so because it's not legal in the Philippines, and also I was curious as to if it has if it was beneficial to the patients.
We also asked her about her experience with cannabinoid administration and what the nurse's role is in doing so.
I can recall that I have given cannabinoids to my patients. As far as I can remember, it was CBD oil, and another one was the CBD gummies. And so I've given them to my patient. You just have to make sure that you give it to the right patient, of course, with the right dosage, the right frequency, and to monitor for any side effects. Also, you have to double check if it was ordered by the doctor, if you have an okay order from the doctor. And one of the biggest responsibilities of administering the cannabinoids is to make sure that it is in a safe place where you store the CBD or the cannabinoids. So you have to make sure that it's in a double locked box or double locked drawer.
Overall, the administration of care related to cannabis by international nurses in Canada may pose certain challenges. The unique aspects regarding the handling of cannabinoids arise from the interplay of legal, regulatory, professional, educational, and cultural factors. Adapting to these factors and ensuring competent and culturally sensitive care is crucial for international nursing students pursuing their studies or practice in Canada. Cannabinoids have been a topic of interest in medical research for their potential therapeutic benefits. However, it's important to note that the field of cannabis research is still evolving, and there is ongoing debate and a need for further investigation to establish conclusive evidence regarding its efficacy. Let us remember that compassionate care and patient well-being are the forefront of palliative care. With further research and collaboration between healthcare professionals and researchers, cannabinoids may become an important therapy to provide comfort and relief for terminally ill patients.
Created using Powtoon.